But meanwhile, in South Korea, one of the ruling party's presidential candidates started a debate after he proposes extending public healthcare insurance to a new area. That's something that's happened here recently. We've been talking about, getting eyes and teeth and ears covered. Well, he wants the top of the head to be covered with insurance and also hair. He wants hair loss treatments to be covered by public insurance, and that has started a real debate in the country. This individual is Lee Jae-myung. He told reporters last week that he thinks hair regrowth treatments should be covered. Please let us know what has been inconvenient for you over hair loss treatments and what must be reflected in policies. I'll present a perfect policy on hair loss treatment. By the way, he has described himself as he wants to be a successful Bernie Sanders, which is a little bit of a neg on Bernie Sanders, but I like that he at least referenced him. So we'll give you more details, but what do you think about this as a stance that he's taking?
No, you cannot be Bernie Sanders and be obsessed with your hair. It just doesn't work. It's diametrically opposed to what Bernie stands for, which is, no combs, no masters. Like that's the law. and yeah, but
no hair or kings, only man.
Yeah, exactly. So yeah, no, stand in bald solidarity with the balding Sanders, although who still's got a fair amount of his hair. I don't know. I got to see what Lee looks like.
Yeah, well, I would hope that ideally he's not biased on this topic.
Sure.
And he's just doing it because he is not bald. I'm looking at him. He has a far better head of hair than I've literally ever had in my life, just to be clear. So this is just, he sees it out there and he wants to help people. So what's the current state? He wants to change it, obviously. Currently, hair loss related to aging and hereditary factors is not covered by the government-run insurance program. Hair loss treatments are only supported if the loss is caused by certain diseases. And online communities for bald people are flooded with messages supporting this proposal. I have to say, I really like this. I think that quality of life, like not dying is not the only point of healthcare. Quality of life is important. And while being bald isn't objectively lowering your quality of life, for some it might well be. And so why not? Right? No.
Yeah, I need to understand more about South Korea's healthcare system, what about sexual reassignment surgery, for trans people? Is that covered? Is that okay? Because if we started introducing that kind of stuff here in the States, like that the right wingers put that on the same level of combating baldness. They put having Cialis for all above wanting to be in the body that you identify with, right? Feeling and needing like a sexual reassignment surgery.
I
to them, they're like, oh no, that's just cosmetic.
Honestly, I think both should be covered for quality of life. As of 2019, Korea's national health insurance coverage did not cover gender affirming care, apparently. But anyway, I think it's certainly an interesting discussion. Feel free to pick it up in the comments. Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.